I am a licensed naturopathic doctor, graduate of Bastyr University, and naturopathic doctors are primary care providers that look more closely at the root cause of health problems and more at natural ways of addressing health concerns. We look at anything that involves prenatal to geriatric, just covering the whole aspect of family medicine, and we do treatments like clinical nutrition, botanical medicine, homeopathy, lifestyle counseling. So a lot of the talks that I give, I try to educate you guys that you have, you're your own best doctor, and there are a lot of things that you could do through lifestyle to be able to prevent and address health conditions at their root cause, and basically guide you towards how you can use your doctor as your partner in your health care. So it should be a unique health care aspect. So our objectives today is to talk about diabetes in terms of what happens when you have it and how it progresses, but how can we prevent it? And how many have heard of that word metabolic syndrome? Raise of hands. So maybe about 25% of the group, not that many. I really want to bring that term to your attention. About 1 in 5 adults in the US have metabolic syndrome and don't know it. So this is really an awakening tool that this is really pre-diabetes, and if we can prevent that, we can prevent the epidemic of diabetes. So we'll talk about that, and then we'll talk about how to treat diabetes if it's already been a diagnosis. So have you guys heard of naturopathic doctors? Raise of hands. Okay, more and more hands go up as I do this. I love it. So basically, it's blending centuries of natural wisdom with current scientific advances. Some people say it's the best of both worlds. And that's part of the reason I like these talks, is that it helps you guys to ask better questions for your doctor, what labs to order in terms of preventing or addressing certain conditions at their root cause. So today's topic happens to be diabetes, but sometimes we talk about digestive health, allergies, different conditions, again, looking at lifestyle and addressing causal treatments. So the term that naturopathic doctors use is ND, and you might hear terms like holistic medicine, complementary alternative, homeopathy. It gets really confusing, but in terms of the licensure, it's ND, which really gives the primary care provider. We're basically general practitioners. And you could see that NDs are recognized as the same level of primary care as MDs and DOs. It is a 4-year postgraduate medical school, and the training is the same as the standard medical training, but in addition, we get a lot of training in the natural therapies. And these are things that include nutritional counseling. A lot of times we look at, what foods are the best for your body. So the hypoallergenic diet. We look at medical nutrition, vitamin mineral therapy. We look at botanical medicine. So today I'll talk about food as medicine, and then certain nutrients that help in terms of blood sugar control, and then certain herbs. So we'll cover all of that. Homeopathy, hydrotherapy, physical medicine, counseling. Some doctors do minor surgery, and we're not against pharmaceutical agents. There's a time and place for it, but we want to always make sure that we treat the cause of the problem so that we use as least of this as possible, or only use it when necessary. So in that case, you could see kind of what we call the therapeutic order, and it's kind of like your food pyramid. You always see the basis for your health is what we call the foundations of health. It's the things you do every single day. So the way you eat, the way you sleep, the way you move, the way you think. Our mind has such a huge power. Our connection with our environment, those are basically the everyday things that we do has to be our core foundation. And then the next one is things that help stimulate our overall vitality. So treatments like homeopathy, acupuncture, counseling, those are things that help the whole. The next one you look at, kind of going up the pyramid, is supporting systems of the body that may be weak. So in this case, we're talking about how can we strengthen the pancreas because of the blood sugar aspect. If it's digestive, we look at digestive health, or if it's cardiovascular, heart health. So it's really looking at that particular system of the body that needs to be strengthened. The next one up is correcting structural integrity. So if someone has like radiation in their arm and it happens to be a pinched nerve, kind of releasing the cervical, perhaps compression or areas that's more musculoskeletal. And then working our way up, there may be a time where we might need to prescribe a natural pharmaceutical agent, such as, let's say, Armour thyroid, which is desiccated thyroid for a hypothyroid patient, or a bioidentical hormone. Those are a little bit more biochemical or closer to the pharmaceutical, but they may be necessary. And you could see further up the pharmaceutical intervention. If someone has high blood pressure and it's uncontrolled, well, the risk of uncontrolled high blood pressure is more dangerous than taking a blood pressure medication. So there are meds that we can use to say first do no harm. So it could reduce your risk of stroke or kidney disease or blindness. So that's a time where it may be necessary. And then same thing with surgery. We don't always go in this order. If someone's asthmatic, we may need to control their asthma attacks with having an inhaler, and then we could prevent them from getting an attack looking at the underlying cause. So any ND that you see, we always follow this philosophy. First of all, looking at treatments that help your body heal itself, looking at the healing power of nature, and then finding the cause of the problem. So if someone, for example, has eczema, we don't want to just say, okay, lather some cortisone cream. You want to say, well, what's causing the eczema? Is it some kind of a food allergy, or is it some kind of a environmental sensitivity? What could it be? So removing that cause. First, do no harm. It again goes back to, if someone has high blood pressure, educating that uncontrolled blood pressure is a bigger deal. And then treating the whole person, mind, body, spirit, always one. This is a big reason that I like to educate is doctor. The word doctor in Latin, which is docere, means to teach. So our job is to really empower you guys to be your own best doctors. And then the last one, prevention is the best cure. And I think this is the best topic for this particular philosophy, in that metabolic syndrome is the precursor to diabetes. So if we can prevent diabetes by addressing metabolic syndrome, we've really done a good job at this preventative aspect. So some of you who came to the heart disease talk may recognize this slide. I kind of want to look at the extreme and then work our way backwards. So when you look at heart disease, it's the #1 cause of death in the US. And if you look at this one, it says it claims more lives each year than the next 4 leading causes of death combined, which is diabetes, cancer, chronic respiratory disease, and accidents. What is deceiving with this stat is that if you take the diabetes out, this stat changes, because a lot of the heart disease is due to diabetics. Because if you look at the next stat, diabetics have 2 to 4 times the risk of developing heart disease. So in the last lecture when we talked about heart health, cholesterol is not the only thing that causes heart disease. A lot of times it's actually diabetes. So if we prevent diabetes, we also prevent heart disease, which happens to be the #1 leading of death. So we kind of want to work backwards and say, okay, diabetes is the one we want to tackle. Well, then the next question is, what causes diabetes? So again, if we work backwards, that's where that term metabolic syndrome comes in, and that's what I want to address today. So if we look at the stats again, you may have heard of some of these words: LDL, HDL, triglycerides. This is part of your cholesterol panel. Clotting, high blood pressure, inflammation, blood flow, and atherosclerosis. All of those, if you look at it, high blood sugar creates harmful changes in any of these. So we always want to, again, work backwards and say, how can we control blood sugar? And then again, here's the term for atherosclerosis, which is the thickening of the artery. So that's a normal artery, and sugar really kind of causes stickiness and causes the lipids to stick to the lining of the vessels. So let's first talk about what diabetes is by definition, and then we can work backwards and say, how can we prevent diabetes? If you look at your digestive system, so here is your liver, and here's your stomach. Right underneath your stomach in the back is your pancreas. And your pancreas is an organ that releases digestive enzymes, but it also is what we call an endocrine system, which basically means that it releases hormones into your blood, in which case releases insulin. So insulin is one of the hormones released by, here's the pancreas, and here are the cells of the pancreas. The beta cells of the pancreas release insulin. They also release glucagon, which helps to increase blood sugar, but insulin's the one that removes sugar from your blood into the cells. So we're going to talk about insulin now. And if you look in here, so let's say that you eat and where is the glucose? Right there. So here's the glucose up there. So let's say you eat like a nice dinner and your blood sugar goes up and suddenly your pancreas says, okay, I need to lower blood sugar and I also need to take the sugar into the cells and give you energy. So here are your cells. Here's one cell right there. Here's another cell right there. And in order to make energy, the sugar has to go into your cells and convert to ATP, which is basically where energy is produced. So if you look at the lining of the cell, the receptor, what insulin does is it binds to the cell and then it opens the door for glucose to go in. So another way to look at it is if here's the cell, the insulin comes in right there, sticks to that, opens the door and allows the glucose to go into the cell. So it's kind of like a lock and key. So without insulin, glucose cannot enter the cell. And that's a big deal because have you heard of the word insulin resistance? You heard of that word? That means that the cells no longer can accept insulin to communicate with it. So it's like they've shut down. They're resisting the action of insulin to take the glucose in. So if glucose doesn't go into your cell, where does it stay? In your blood. And that's why your doctor says your blood sugar is high. So part of the elevated blood sugar is either you have insulin resistance or it may be that you're just eating too much sugar and insulin's just like trying to catch up and it's struggling and it's backed up. So that's why we want to look at insulin. The other thing I want to point out is not every single cell of your body relies on this kind of lock and key method, okay? There are exceptions to that. And these are the cells, part of the body that do not take insulin. So our brain, our nervous system, our heart, blood vessels, and kidneys do not use insulin, and they pick up glucose directly from the blood. That makes it sound like a good thing. In a way it is. You know, our brain relies solely on sugar for energy, so we want to bypass this whole insulin aspect. But the problem with that is too much sugar damages these organs. So in a way, the body can protect itself, but these tissues are susceptible to too much sugar. This is why you hear about, our eye vessels. So blood vessels and also the eyes. So retinopathy, you heard about that? Diabetics can have damage to the vessels of their eye, or they may have problems with their kidneys. You've heard of Alzheimer's. That could be too much. Diabetics have a higher risk of Alzheimer's. It's the toxic effect of sugar on those organs. Same thing with the nervous system. You've heard of diabetes neuropathy. It's the nerves in the hands or feet that you get tingling. It's because sugar is damaging those organs. So whenever we talk about blood sugar control, part of the control is that we want to make sure we protect these organs. So part of the consequences of uncontrolled diabetes is that we can get heart disease, we can get neuropathy, nephropathy, neuropathy. I mean, there are people who've gotten leg amputations because they've lost that nerve communication and it just the blood supply. So that could be the most extreme form of uncontrolled diabetes. It could cause blindness and it increases the risk for Alzheimer's. So if we work backwards, how do we prevent diabetes? These are some of the words we want to take away from our language and address. So prediabetes, insulin resistance, and metabolic syndrome. And you may ask what metabolic syndrome is. And syndrome's typically a group of conditions that kind of make you kind of at risk. So if you look at, in this case, 3 of any of these will give the diagnosis of metabolic syndrome. So if someone has elevated waistline, especially abdominal obesity, so in men, a waistline greater than 40 inches, in women, 35 inches or above. Altered blood lipids, so if they have low HDL or high LDL, or elevated triglycerides, if they have high blood pressure, insulin resistance, high blood sugar, high CRP, or thrombotic state. So there's a test called fibrinogen, which checks for clotting. So if that's elevated, Or the doctor may say, you know what, your liver enzymes are high, you have fatty liver. Or women who have polycystic ovary disease, that actually increases the risk for diabetes. And then skin tags, which is actually if you notice that you're getting more and more skin tags, you definitely want to tell your doctor, check my blood sugar because it may be related to that. So if you look at your handout, under the bottom of the first page, it has recommendations for the tests that would be good to ask your doctor to do. And the most common thing that I noticed does not get checked is your insulin levels. A lot of doctors just do a fasting blood sugar, and it's kind of like cramming for a test at the last minute. It's like, I'm just gonna be good for a day and get my blood sugar test, but you could have months and months of being bad, right? Which another test called hemoglobin A1C will capture. That's like a 3-month average of your blood sugar control. But insulin is even a better indicator because your blood sugar may be controlled because insulin's working overtime to control it. But as a result, your insulin levels will be elevated. And the doctor can say, you know what, your pancreas is working overtime. Let's try to reduce the load of it. So the other thing I've noticed in the normal parts of your labs, you know when you guys have your lab work and it says what your results are, and then the reference range, I've noticed for insulin, it says a normal range is from 0 to 20. Well, anything between 10 and 20 is prediabetes. And a lot of doctors, unfortunately, they don't have time to read between the lines. They just don't see a bolded abnormal, and they're like, okay, you're fine. But a lot of people won't pass the test of, wait a minute, you're in that borderline, let's address it. So an optimum insulin at least should be under 10, but under 6 is even better. So that's hopefully in your handouts. If not, take that down. Yeah, go ahead.
Sorry, what's CRP?
CRP is a marker for inflammation. It stands for C-reactive protein. Definitely ask your doctor for that. It doesn't tell you where the inflammation is, but it's an indication of how much inflammation is in the body. So the ideal is that it should be under 1, but anything over 3, you want to just kind of think about, okay, where there may be inflammation going on.
You see this on a physical level?
Well, some people have aches and pains, so inflammation and pain go hand in hand. But for some people, they don't feel any pain, but there may be atherosclerosis, so plaque formation in the arteries. So it's just a good marker. Any kind of inflammation is a good indication that there may be some pathology going on. So that's kind of where you see itis, like arthritis or pharyngitis. You know, any itis is inflammation and pain. Okay, so let's take a look at one of the risk factors, which is central obesity. So this is something I picked up from Dr. Oz. He no longer calls weight management, he actually says waste management, because a lot of it, if I can skip forward to this here, a lot of the organs, if we have kind of the central part, a lot of our organs is our midsection. And so if our body distribution focuses mostly on there, it could damage the organs. Whereas for some people, if they carry their waist kind of in their waist, in their thigh area, there aren't any organs. So your body shape actually is a big determination. But another one to look at is just the insulin resistance part. And again, ask your doctor to check what we call a fasting insulin to make sure you don't have that. So anything over 10, you want to think about, am I eating too much sugar? And we'll talk about how to reduce some of that potential of, there are a lot of foods that sneak into our diet, and we don't even think that it's sugar. So I'm going to bring that to your attention today. The other risk factors are, aging, and I don't mean just aging like I have no control over it. As we age, our body stores of pancreas gets less and less because we use up our pancreas gets exhausted. So one of the anti-aging protocols is to lower the effect of insulin on our cells. So this is why you might see studies on therapeutic fasting or reducing caloric intake on increasing aging, is because there's less pressure on the insulin. Genetics, again, it's not just I have no control over my genes. It's more that the environment you put your body determines the expression of your genes. So if you have a family history of diabetes, you want to be even more alert that the environment I put myself in can make those genes either active or it could keep them dormant. And then lack of exercise, which we'll talk about what kind of exercises help in this aspect. So we talked about that. This is a very crude way of measuring what an ideal weight would be. There's other ways that I'll talk about, but it kind of gives you an idea of where you should be. So it's called a body mass index, and you could download this chart online. So for example, if someone's 5'6" and they weigh 155 pounds, their body mass index is 25, which puts them at the overweight area. And you could just basically take your weight and see what zone, if it's obese or overweight, and then you could kind of work backwards and say, well, for someone who's 5'6", their ideal weight is between 180 and 148, which puts them at the BMI of 19 to 24. So it gives you a good idea of where you should be in the ballpark. Where it goes a little bit kind of like a false high maybe is those who are too lean, they're too muscular. So their weight looks high, but it's not fat. It's actually like, muscle mass is a good indicator of vitality and anti-aging. So another way we can measure it is through what we call a body composition test. It's basically a machine that measures your fat to muscle ratio. So two people can weigh the same on a scale, but when we measure their body composition, we'll see that the same weight, one person can have a lot more muscle mass and another person can have more body fat. So there's certain people that even look thin, but we call them skinny fat because their body fat's a lot higher than what you would expect. But just going back to the BMI, the reason I bring it up is that you can see as your BMI goes up, your risk for diabetes goes up as well. So again, it's a good crude indicator, but if you want to get more of it detailed, I would recommend doing a body composition analysis. Going back to the recommended tests, again, these are in your handouts. Fasting blood sugar is something normally your doctor does, but I'd like to go a couple steps further and do a hemoglobin A1C and especially a fasting serum insulin. Lipid profile, homocysteine is a marker for, it's an independent marker for heart disease, so definitely get that addressed. We talked about highly sensitive CRP with inflammation, getting a kidney and liver function checked, and then the body composition analysis. So here's the key again, a normal fasting insulin should be less than 10 and not 20. So if your doctor says you're okay, it's because sometimes I just look at those normals. It's not normal, it's actually prediabetes. And ideally it should be under 6. So this is just kind of reviewing what we're going to talk about next in terms of treatment. We're going to look at determinants of health and what things we could do to make sure our insulin level is normal. Because let's say that your insulin's 12. It's like, how do I lower my insulin levels? And the good news is I always want to give people hope. Your body heals itself. And if you do certain things, even the smallest changes, repeat your blood work, your body responds. So it's not always, people look at their lab work and they say, you know what, I have bad news, my labs look bad. It's really, let's make some changes, let's repeat your labs, and you'll be amazed how quickly your body heals. So this should be a more hopeful aspect. So first thing we're going to talk about is lifestyle changes. We'll talk about healthy eating, exercise. We'll talk about supplements because there are some good supplements on the market that help blood sugar. But I don't want to give you guys the impression that you could just pop a pill, because it's kind of like, people saying I'm going to have like a piece of cheesecake and then I'm going to pop Chromium, because Chromium is supposed to lower blood sugar and it's supposed to balance it out. It's kind of like, a monster load versus a tiny little pill. Usually supplements kind of help give you that extra bit of bonus, extra bit of insurance, but a lot of it is in your hands with regards to your lifestyle, the things you do every single day. So, and diet is actually a big part. I always use cheesecake because a small amount is usually like 600 to 800 calories, and for you to be able to burn that, you have to walk about 6 to 8 miles. So it takes maybe 3 hours depending on how fast you go, but maybe an hour to 2 hours to walk that much, and it takes maybe 10 minutes to finish the cheesecake. So it's just looking at how can I give my body the most nutrition and stress it the least as I can without putting too much pressure on it. So we'll talk about that. I'll talk about some, if you're already taking certain medications like metformin or glucophage, what things to watch for. So we'll go over that. And then there's sometimes that, doctors might say, basically we're trying to prevent all this from happening, either a pacemaker or coronary bypass or, God forbid, a leg amputation because blood sugar is just uncontrollable. So let's work our way backward. Have you guys heard of the term low glycemic index? Okay, or low glycemic index diet. There is a resource here. It's mendoza.com on the back of your handouts. Anything that we don't talk about and you're curious, just go to this website, type the word, and it'll tell you the index. The chart tells you what a high glycemic index is. So anything over 70 is a high glycemic index food. Anything that's low is 55 and below. And then if you look at the word below glycemic index, glycemic load, that's the portion size. So there's certain foods that are low glycemic index, but if you eat double, triple, quadruple amounts of it, it adds up to be a big problem. So the glycemic load looks at, well, if I look at the serving size of that food, is it a high glycemic effect on the body? So sometimes you'll look at numbers that are more the glycemic load. So I'll talk about how to incorporate both of those. And then, yeah, we're just going to skip forward to these later. So let's just keep going with that. So here's glycemic. The term is basically describing how quickly your blood sugar rises. So the higher the glycemic index, the more sugar gets released into your bloodstream. So the highest score is 100. That's why anything over 70 is considered a high glycemic. So if someone just eats pure sugar, a score of 100 is given because 100% of it converts to sugar. The presence of fats, fiber, and protein typically slows the release of sugar. So if you eat anything sweet, you want to kind of match it. So for example, if you have a piece of apple, you want to have some nuts or avocados or maybe a piece of cheese to slow down the release of this apple from going to your bloodstream. There's certain foods that you might notice are naturally low glycemic, and you'll start to say, hey, this food has a lot of protein. Well, no wonder it's low in sugar. So kind of start to analyze foods in that aspect. A lot of times things like white bread, French fries, soda, fruit juice, that's just pure sugar into the blood. So it's really stressful for your pancreas. And the higher the glycemic index, the faster your blood sugar rises. And suddenly your pancreas says, whoa, we can't have this. We got to lower blood sugar. And suddenly your insulin kicks in. Your blood sugar will crash as quickly as it rose. And when it crashes, your body says, I'm hungry, I'm ready to eat again. And that's when you see that, I'm going to skip over a little bit here, that little vicious cookie cycle we talk about. So if someone eats a high glycemic food, their blood sugar rises, their insulin rises, and then suddenly insulin lowers blood sugar, takes all the sugar from the blood into the cell. And if you don't burn it, if you don't exercise it out, it converts it into fat. And then suddenly your blood sugar is low because all the sugar went from your blood to your cell, and the body says, I'm hungry. And if you eat a high glycemic food, within an hour, you're ready to eat. So it really makes people feel constantly hungry. So within an hour, they're eating, and they want something sugary right away because they're like, I'm starving, and they'll crave high glycemic foods again. So that's that vicious cycle we want to end. So if you look in here, a high glycemic food, you can see that light blue one, makes your blood sugar go up really fast. Here's your blood sugar, here's time. So within half an hour, your blood sugar, which likes to be in this range, spikes up. Insulin comes in, lowers it, and lowers it way too low. So this is like below this line means you're hungry, you're ready to eat. And then this vicious cycle continues. But if you eat a low glycemic food, your blood sugar doesn't spike up as fast. It kind of spikes slower. Your blood sugar stays up. You can see like within an hour and a half, you're still feeling good, unlike this person who's starving. And then maybe by 3 hours, you start to go down, which is normal to eat every 3 to 4 hours. But if you're hungry any sooner than that, you're either eating the wrong foods or maybe not eating enough. But you want to think about your diet. Just want to show you some foods that are low glycemic. It would be things like apples, berries, grapefruits, lentils, beans, nuts, oatmeal if it's unsweetened. This is kind of questionable. Some yogurt can have some sugar, but unsweetened is the best way to go. Candies, cookies, anything processed is high glycemic. So white potatoes, we're going to talk about, this is a big awakening thing. A lot of cereals, you might as well just have a piece of cake. Like, they're just terrible. So just kind of going to wake you up to some of the foods that may be sneaking into our diet. So in general, avoid processed saturated fats like margarines. hydrogenated oils, anything that's packaged and has like, sitting in the shelf for years, something's wrong with it. So avoid that. Limit fried foods, fast foods, just kind of avoid, anything that, again, is greasy and fried in high temperatures. And then limit simple carbohydrates and sugars, and anything that says high fructose corn syrup. They all are really toxic for the pancreas and really affect your insulin. So this is a really good rule if you want to write this down. I think if there's maybe one thing to get out of today's lecture, I would say this is it. Avoid foods with more than 6 to 8 grams of sugar per serving. And this is when you go to the grocery store and you start shopping. And I love this for kids. A lot of kids, TV commercials really get them. Even when I was a kid, what was it, Trex or whatever with the rabbit, it was so cute. So they always get me, and they had like prizes in the boxes. But when you educate kids to go and pick a cereal that says, less than 6 to 8 grams, they're no longer influenced by advertising. They start to say, hey, look what I found, it's under 6 grams. So it's really good to empower kids to pick things that, there's a reason we're picking it for you. It's not just because I'm trying to be mean and I don't like rabbits or something like that. So just give them that tool. The reason that number 6 to 8 stands out is that 4 grams of sugar is 1 sugar cube. And a lot of foods have like 12 grams or more than that. And you don't even think about the fact that you're putting sugar cubes into your food. You think, oh, there's no sugar in here. I didn't put it, so it must not be in there. But it starts to sneak in. So let's look at some examples. Honey Nut Cheerios. Sounds good, doesn't it? Cheerios is oats, is good for you. 12 grams of sugar in 1 cup. So it's like putting 3 cubes of sugar. Raisin Bran, again, it's a raisin, it's a bran, it's gotta be good for me. 18 grams of sugar in 1 cup. And a cup isn't that much. Some people even have 2 cups, and it's kind of like having a Coca-Cola. So that's 4.5 cubes of sugar. A granola bar, and Nature's Valley, it sounds like a fairly good one. And it's not bad, it's just, again, back to that glycemic load, the portion size. So if you have 2 bars, that's 12 grams, it's like having 3 cubes. If you stick to this rule of avoid anything with 6 to 8 grams of sugar, well, if you have 1 bar, that's gonna cut it down to 6 grams. So again, it's back to portion sizes. Let's look at a few more. This actually came from ewg.org. I really, really like this website. If you guys want to even get on their mailing list, they're the ones that produce the Dirty Dozen. If you've heard of it, it's the basically top 12 foods that you want to avoid because they're high in pesticides and you want to get organic. And then they also have the Clean 15. So basically top 15 foods that are resistive to pests and they don't use pesticides. So you can get them non-organic. So they came up with that. They come up with products that may be, hard for your hormones. They might have PCPs or, a lot of preservatives. So they kind of give you a lot of guidance on clean products, whether it's cosmetics or house cleaning items or, again, foods. But they also came up with, if you just go here and search best and worst cereals, they have like a printout of a report of all the common cereals that we eat and what they're like. So a couple of things that kind of struck out with me was a cup of Honey Nut Cheerios is like having 3 Chips Ahoy cookies in terms of their sugar content. Or Honey Smacks, a cup is like having 1 Twinkie. So it's kind of like the whole eat this, not that kind of comparing what it's like eating those 18 grams of sugar. I mean, that's just crazy. Here's another nice visual. And again, these are the 2 that really got me. I mean, we think that's pomegranate juice. It's gotta be good for you. They add 62 grams of sugar for 1 bottle. And it's not uncommon that I hear people, they drink all of it in one sitting. No wonder they feel queasy or they just can't focus all day. Their blood sugar is just haywire. Vitamin water, now they've come up with, I think, a Stevia one, which is better, but they used to add so much sugar to just 1 bottle. 8 teaspoons of water in just that. Orange juice. How many of us drink orange juice every morning and not realize there's so much sugar added? So you want to avoid things that you unconsciously don't realize is increasing your burden of sugar into your cells. We always think Red Bull's horrible, but if you look in relation to all the other seemingly less or more innocent foods, it's actually not as bad as what you might think compared to orange juice. So It's a big awakening tool. That said, I'm not suggesting to eat artificial sweeteners. A lot of people say, well, I have a Coca-Cola, but it's diet. Few problems with that. One is just because something is diet doesn't mean it doesn't have an effect on your blood sugar. Believe it or not, just the thought of eating something sweet makes your body release insulin. So there is a mind-body component to that. But the bigger element is even the artificial aspect. Aspartame, which is the label of NutraSweet and Equal, has a lot of chemicals, mainly formaldehyde, that is cancer-causing. It interferes with your hormones. It's been shown to increase the risk of prostate and breast cancer. It can cause kidney damage. And even a bigger deal, and I've had cases of this where people get anxiety attacks, they've had seizures, it could trigger depression. There was one study where they had to stop the study because people were becoming depressed from having to drink this high drinks that were rich in aspartame. So, a lot of these have been documented. They're not natural. They affect our physiology. And they can trigger migraine headaches. So again, it's back to remove the obstacle to cure, treat the cause. If someone's got headaches, it might be that they're eating the wrong foods. The other problem is fructose, and it might show up in the form of high fructose corn syrup. Agave, we've realized over the last few years it's not as good. Have you heard of agave syrup? We thought it was good for us, but it turns out it's really high in fructose. Too much fructose can damage your liver. So if you have, for example, fatty liver, or you've had elevated uric acid, you might want to look at your fructose intake. That might be the problem. And you could see the liver aspect. So now it's like, what do I eat? So there's a lot we can eat, right? First of all, there's a lot of low glycemic things we could eat that do not affect our insulin the way we think. So if you eat some of the things that are a little bit sweeter, like apples, pears, berries, or carrots, just mix them in a little bit amount of fats or proteins. So that could be nuts and seeds like walnuts, almonds, cashews, and pumpkin seeds, or even nut butters, like a tablespoon or two of nut butters. Hummus is also really good. It's got some tahini, which is sesame seeds, so it kind of gives you the good fats. It's got some protein from the beans, the chickpeas, and then some cheese or avocado. So you always want to just pair your foods together. A little note before we look at other foods. Have you guys heard of stevia? So thankfully, stevia is, we're getting more and more positive reviews about it. It's been used for thousands of years in South America. It's really popular in Japan. It took a long time, but finally the FDA said, okay, it's safe. It's like they've kind of said the safety of artificial sweeteners, and now it's like, wait, that's not so safe. How are we saying this isn't safe? But thankfully, artificial sweeteners are getting, there's enough research to prove that it's harmful for you, whereas stevia is getting the opposite. It's showing that there's actually no effect on blood sugar or insulin. So, there are some reports that it can even help reduce blood sugar. I've never seen that. Like, I would never tell someone, eat stevia if you're diabetic. I would just say, if you want some kind of a sweetening effect, this is probably the better one than, honey or even regular sugar, just because it has no negative effect on insulin. These are some brands I've seen at the stores, Sweet Leaf or stevia and the raw, and they have it in packets, and it tends to be one of the better tasting ones. Sometimes there's like an aftertaste with stevia, and this tends to be better. What really blows my mind too is, first of all, it's a leaf. So even though you see it in a packet, it is a plant. It's a natural, it's an herb. But it tends to be 100 to 200 times more sweet than regular sugar. And if you ever get a chance to look at the plant, just take like a leaf of it and start chewing it, and you'll see for yourself how sweet it is. It's just amazing what nature has to offer. So I would say this is probably a better alternative, but to be honest, it's just so great to get used to the natural taste of food. Last thing I want people to do is have some berries and add sugar to it, whether it's stevia or any kind of sugar. Strawberries are sweet. Why are we just spoiling your taste buds. There is a set point with your tongue. The sweeter you eat it, the more sugar it wants. It has an addictive quality to it. So there is sometimes a withdrawal period. If you find yourself kind of addicted to sugars, there's about a week to 2 weeks period where it's uncomfortable. But after a while, you'll find yourself kind of getting a sense of peace that I don't need as much sugars to be able to feel good. So there's a set point. Now, I also want to bring your attention to grains. This is probably an area you will not see so much, especially with nutritionists. We're still stuck on eat 5 to 6 servings of whole grains a day. And I think this is why we have so many diabetics in our society, and we have appetites. The grains make you want more food because they're really hard on your pancreas. So if you limit your grains, especially if you're overweight, to 1 to 2 servings a day, it really takes the load off your insulin. And grains are not just wheat. I mean, it could be rice, it could be tortillas, oats, quinoa. And a serving is typically about a cup. So you want to limit your intake to 1 to 2 cups a day. This doesn't mean it's Atkins or low carb diet. You can still have starchy vegetables like carrots or yams. You can have apples, pears, berries, legumes. All of these have a good quality carbohydrates in there, complex carbohydrate, but there's something about grains that can sometimes get in the way of our metabolism. If you want some references with that, there's some good books out there that are helpful. The newest one is the Grain Brain. I don't know if you guys have heard of it. I really hope the library has it. If not, ask the library to carry it. It's by Dr. Perlmutter. He is a neurologist, and just great information about what grains can do, not only to our gut, but to our brain, to preventing Alzheimer's. You want to basically reduce the load of insulin through reducing grains. There are a couple other books. One is Wheat Belly. The other is the No Grain Diet. So any of these kind of give you more information about why we want to reduce grains as much as possible. Okay, so now it goes to what do I eat? You want to eat as many vegetables as you can, and I think a good amount would be reaching up to about 8 servings a day. It seems like a lot, but half a cup of raw is about 1 serving. So if you have like a salad, that's probably 4 or 5 servings right there. So if you have salad with your lunch and dinner, if you have maybe some kind of a shake or a smoothie, you're probably getting close to that without realizing it. Just make sure, they say you've got that magic 5. They say eat 5 servings of fruits and vegetables. A lot of people are like, all right, I'll eat 5 fruit a day. That adds up with the sugar, right? So just limit your fruit to 2. For some people, I might reduce it if they're diabetic. For others, if they're really athletic and they work out a lot, I might increase it. So this is a bit of a cookie cutter. Again, we want to treat the individual, but this just gives you an idea of like the guidelines. One of my favorite foods to use as medicine is garlic and onions, because it's kind of a blood thinner. It prevents the platelets from sticking to each other. So it's just a really great way to increase blood flow and to lower cholesterol. I also love berries. Berries are rich in flavonoids. They usually help to prevent varicose veins because they strengthen the vessels. They're great for increasing the strength of your retina, the vessels of your eye. So anyone who has retinopathy or neuropathy, I really encourage them to have more berries. So that's one. And then celery. There's a lot of good research coming out that 3 to 4 stalks of celery decreases blood pressure. So, and it's also 0 calories, and it's a good appetite suppressant. So really like that. Lean animal is a great way, especially for diabetics, to get their nutrition without their blood sugar spiking up. So make sure you get 1 to 2 servings of, if you're vegetarian, obviously not, but making sure you have protein somewhere in, with your meals. You don't want to just eat a whole load of sugar and just spike your blood sugar. So a vegetarian source could be, you can have beans, legumes, you can have nuts, seeds, avocados, they're actually high in protein, broccoli. Just have something that doesn't just spike your blood sugar. High fiber is really important too. Again, fiber does slow the release of sugar. So you can either just get it through leafy green vegetables, you can get it through flax, oat bran, or psyllium. This is a big one. Get used to tasting water. You know, sometimes our tongue is used to sugar and it takes a long time to go, oh, water's boring. But eventually, I think a sign of health is when you really appreciate water and, you know, you look forward to being hydrated. So 8 cups is like just another key, is another keyword. You want to kind of go by your body weight. So whatever your weight is in pounds, divided by 3, that's the minimum you should have. And then an ideal would be closer to half of your weight. So that's kind of the ballpark. If it's a hotter day, if you've worked out, if you sweat, you know, add about another cup or so. So that way you make sure you're hydrated. You can also look at the color of your urine. So if it's dark yellow, drink more water. Question, yeah.
Lean animal protein, what do you do servings per week or per day?
So I put a week in that it's the minimum that, you know, especially for a diabetic, because it's important to eat protein, and a lot of times diabetics, they're just focusing so much on just getting calories that it comes from starchy vegetables. So this is the minimum. For some, I actually don't have a problem with eating every day. It just depends on the person. If they're vegetarian, it's just get some kind of protein every day. So this is just kind of giving you a ballpark of, you know, it'd be okay to have 1 or 2 a week without worrying about, well, I heard too much meat is bad for me, too much meat is inflammatory. There are a lot of books that suggest vegetarianism for, you know, treating heart disease or diabetes. It's okay to have a little bit of meat if you're okay with not being vegetarian. So I just wanted to kind of confirm that not everybody does well if they're vegetarian, yeah. Okay, and then we talked about glycemic index and load being low. Okay, so with regards to exercise, there's 2 types of exercise. There's aerobic and anaerobic, and they both have benefits on your insulin levels. The aerobic part is basically what gets your cardiovascular system going. So it's, you know, anything that, you know, running, bicycling, elliptical, anything that kind of, again, gets a lot of circulation going. The benefits of that are, if you remember that picture we had where the cell had that insulin receptor, sometimes when we have insulin resistance, it's that that particular receptor shuts down and says, I'm exhausted, I don't want to deal with it. What exercise does is that it actually creates a new receptor. So exercise can actually open doors for your cells to metabolize sugar. The type of the receptor is called GLUT4, GLUT-4. It's a type of receptor that exercise helps to open up. So this is why for some diabetics, as soon as they start exercising, they actually get hypoglycemic, is because they're on insulin or they're on certain blood sugar medication, and exercise is so effective at lowering their blood sugar that suddenly their drug becomes too much. So you could actually use that to wean off your medication, obviously with the guidance of a doctor. That's why I have this blood sugar should be monitored every 10 minutes when starting an exercise, because it's that powerful that exercise can lower your blood sugar. So that's the benefit of aerobic, is that it starts to open the doors on your cells to burn off the sugar. The benefits of anaerobic, which is basically ones that you do when you weight lift, it's not utilizing your lungs and oxygen as much as aerobic does, is that you maintain muscle mass. And a lot of our anti-aging protocols look at the more muscle we have as we get older, the more we preserve aging. So you want to have the 2 of them together, not to mention that it, you know, helps prevent osteoporosis, it's good for flexibility and balance. So you kind of want to address both of these together. And I've actually seen a lot of people, because when you weight lift, your muscles burn up sugar so much, right? So when you're weightlifting, you can really kind of burn the sugar faster. So weightlifting is a great way for weight loss. Okay, so I think every talk that I give, I always put this slide, because a lot of times when your body's under stress, it releases the hormone cortisol. And cortisol is that hormone in your body that says fight or flight. Your body's under danger, it needs to survive, and stress. And cortisol can actually stimulate your body to release sugar. And a lot of people can have problems with balancing their blood sugar because cortisol's got that negative effect on blood sugar. So a lot of these techniques can actually help balance your blood sugar by lowering the effect that cortisol may have. And whatever works for you in terms of relaxing. A lot of people just, there's so much on the go that I just tell them, do nothing. Like spend just 10 minutes a day just, staring outside at the blue sky, or, just really give yourself space to just, don't just constantly do stuff. So that's just spending time with nature. Yoga obviously has the benefit of deep breathing and flexibility and just really appreciating what your body can do. Breathing exercises, meditation. Exercise obviously is a form of stress management, and downtime. This is a really big thing for this area. A lot of people just are workaholics, so it's just something I always push on them. And perception. If it's something that just takes changing the way you see it, that could obviously affect the way you see the world. If you see everything as stressful and it's just because, it's just traffic, and you say, well, okay, there's some things in my life that are stressful, but on the weekend I'll make sure I balance it out. You can really change the way you view your life. Okay, how are we on time? Okay, perfect. So the last part is gonna go over certain dietary supplements. These are the main ones we're gonna talk about: some B vitamins, vitamin C, vitamin D, chromium, CalMag. I'm gonna talk about this herb gymnema, and then talk about a few of what we call the antioxidants that help diabetics. Just a little bit of a disclaimer for supplements. It's always important to talk to your doctor about these. While they are safe and effective, they are effective, and they could change the way your drugs, the dosage of your drugs. So you don't want to just, especially if you have problems with your blood sugar, you don't want to just suddenly take this and become hypoglycemic, because the two of them together can be so effective that your blood sugar gets affected. So talk to your doctor about it. There's certain drug nutrient interactions. For example, if someone's on Coumadin, it's really difficult to give them anything. This is a blood thinner. And blood thinners, are affected by even vegetables. Vitamin K, they're affected by fish oil, they're affected by garlic. You want to make sure someone's watching your clotting time. That said, there are even certain drugs that deplete your body. So it's the opposite end. You want to, instead of avoiding certain things, you want to add certain things. So this is a big example right here. Glucophage, which is one type of medication for diabetes, it's a very common one, depletes CoQ10, B12, and folic acid. This one's a very easy test to ask your doctor to do, and you could just say, no fasting required, just get your B12 checked. It's one that again gets missed by doctors. The range on the lab is from 200 to 1100. I mean, talk about a big wide range, right? And I see a lot of people in the 300-400s, so they're suboptimal. A good range to be is like 700 to 800. So a lot of patients on either glucophage or metformin, you can see that also depletes B12, need extra B12, because B12 is required for carbohydrate metabolism, protein metabolism, just overall energy. So definitely have your B12 levels checked. And then there are labs that check folic acid or CoQ10. They're not as common as B12, but you could obviously check that. I would just say you could supplement with it if you're on the medication, but you can talk to your doctor. Yeah.
Can you take the B12 if you're taking blood thinners?
Yes, B12 does not thin the blood, but again, your doctor's usually on it about checking your clotting time every time that you adjust your diet or supplement. So
It's Plavix.
Yes, Plavix as well. Mm-hmm. Okay, so chromium is one of my favorites for also reducing blood sugar. The reason I like it is we're going to go back to that cell again. Chromium increases the sensitivity of the cell to accepting insulin and reducing blood sugar. So it's great because when your sugar gets metabolized, your body gets satisfied. So you don't need to constantly eat sugar. And so in that way, it satisfies sugar cravings. It helps to balance your blood sugar. So if you're hypo or hyperglycemic, it tends to address both. It helps to make insulin work better. And you could take anywhere from 100 to 500 milligrams in divided doses. So it's just something to think about. But at the same time, again, think about someone who's drinking like that huge orange juice or that huge pomegranate juice. This is going to be a tiny part of the equation compared to dietary intake. So this is for someone who's done a fantastic job with their diet and they're still kind of on the edge, and it's like, I just need a little bit more help. What else you got? This could make you that, give you that extra edge. Other ones to think about, I really like antioxidants because they protect your vessels from becoming damaged. If you guys look at the heart disease talk, we talked a lot about atherosclerosis, which is plaque damaging to the arteries. And antioxidants protect plaque formation. So things like vitamin A, C, E, selenium, alpha-lipoic acid, and CoQ10 are antioxidants that prevent the free radicals from damaging the arteries. Alpha-lipoic acid is actually considered a universal antioxidant because it's both fat and water soluble, and so it's a lot of times actually in Europe it's the standard of care for neuropathy. So a lot of people who have some kind of a diabetic neuropathy or neuropathy in general, they recommend alpha-lipoic acid. So it protects damage against the nerves. And then also lowers blood sugar and insulin levels. So it has a lot of benefits on that end. And then CoQ10 is also another form of antioxidant. It's a little bit more about energy production. So those who have either congestive heart failure or some kind of arrhythmia, or even fibromyalgia, anything to do with contraction of the muscle, whether it's the heart muscle or the skeletal muscle, it tends to be really helpful. So chest pains, high blood pressure, mitral valve prolapse, or congestive heart failure tends to help. It tends to be depleted with people who take statins. I didn't put that in the last handout. So both glucophage and statins deplete CoQ10, so you want to supplement CoQ10. That's part of the side effects. People get muscle pain from taking a statin. It's because they're lacking or they're depleted in CoQ10. Here's that picture again of the pancreas releasing different cells. The beta cell is what releases insulin. So sometimes, and I didn't mention this part of the equation, for some people, their insulin levels is high when we measure it in your labs, okay? If it's high, it's a sign that you're eating too much sugar and your insulin's working overtime to try to control blood sugar. So if you get high levels, it's diet related. If your blood sugar is normal, but your insulin level is also low, it means that perhaps your pancreas is exhausted and it's burned out. It's not releasing enough beta cells. We see this in type 1 diabetes. This is why type 1 diabetes need insulin, because their body's not making insulin, so we have to give them insulin to be able to control their blood sugar. For a type 2 diabetic, they may have just exhausted their pancreas, and their pancreas just doesn't, this beta cell gets less and less and less, and it doesn't make pancreas anymore. What Gymnema does right here, it's an herb that actually helps your pancreas make more of that cell. So it regenerates the pancreas to make more beta cells, and as a result, more insulin can get secreted. So that's something that I recommend more if someone has an exhausted or abnormally low levels of insulin. So Gymnema is a very popular herb in Ayurvedic medicine, but it's been used now in this country. Another one that I really like is your plain essential fatty acids, whether it's fish oil, flax oil, you can get it through omega-3s like, walnuts. And the benefit of that, evening primrose oil, the benefit of that is that every single cell of your body is made up of fatty acids. So if you give your body good fats, it strengthens the membrane of your cell. And remember that receptor we mentioned with insulin? The door of the insulin opens and glucose goes in. Well, insulin has to stick to the receptor of the cell, right? So if the cell's strong, that communication becomes better. So whatever you give to support the membrane, your body really functions and adapts to better. So definitely focus on your omega-3s. The way to read it is the component of the omega-3 that's beneficial is the EPA. And you want to make sure the EPA is about 1,000 to 2,000 milligrams a day. Don't just look at the total, which is these two combined. You want to break it down to this one. And a good marker to see if there's inflammation, because fish oil or any kind of omega-3 lowers inflammation, is to measure the CRP. We talked about CRP, highly sensitive C-reactive protein. If it's elevated, it gives me more reasons to tell people to increase their omega-3s.
Can anybody take this Jimmy?
I don't recommend it for everybody. It's individual, right? I mean, it's kind of goes back to this. If someone has a horrible diet, I want to work on that. Now, this kind of could buy me time. I think this is why we have it backwards in our country. Doctors get afraid of, okay, this patient's not going to listen to me. They're probably diabetic for a reason. Here's your medication. Off you go. I don't want to have that perspective. I want to really educate someone on their diet. So this could kind of buy time, especially if their insulin is really burned out. This could kind of help regenerate. But I don't think we do anyone a service if we don't talk about their diet.
Pancreas doesn't work properly. What's the symptom that person will give?
A symptom of what?
If the pancreas is not working
Oh, they
properly,
have
because
low
there's no
insulin.
beta cells or reduced beta cell. What that person will show?
Symptomatically, they might get jittery, like their blood sugar is not absorbed. Sometimes you don't even know. You have to get a blood test. So that's why I say ask your doctor to get your insulin levels checked. So it'd be low levels of insulin. In the lab, it might say less than 2. It's like the lab can't even measure it. So anywhere between 2 and 6 is like a good level of insulin. For some people, if it's low, it might be because they're on a low carbohydrate diet. So that might be a different case. But if someone's eating, normal amounts of food, if anything, too much sugar, and their insulin can't even be measured, something's up. Their body's not making enough insulin. It's very individual. Yeah.
What, 8?
What's that?
I think they're 8.
8? Like,
And you said insulin levels 2 to 6 is good.
oh, like number 8, if the insulin's, well, anything under 10 is acceptable. So if it's 8, I just kind of tighten it up a little bit more. But between 10 and 20 is prediabetes, which I don't see a lot of labs pick up on that. They just say under 20 you're okay, and that's not good. Okay, this is I think the last slide, and then we'll do question and answer. I've been really impressed by the data that's come out from this herb berberine. You may have heard of berberine from plants. It's a flavonoid found in plants such as berberis. You may have heard of Oregon grape, or barberry, which is those berries up there, or hydrastis, golden seal. You may have heard of that. So it's derived from certain herbs. It's one of the main ingredients. It has like a really rich color, almost looks like turmeric. And what's really amazing is that it's been shown to lower blood sugar, insulin, hemoglobin A1C, and LDL. And there are so many studies that I could not believe it was as effective as metformin in lowering blood sugar. So it's something that I'm more and more paying attention to, and I see a lot of my colleagues and a lot of research coming out as how effective it is. So definitely take a look at berberine. The research studies that have been shown in terms of the effectiveness have looked at 500 milligrams 2 to 3 times a day. So again, it's in divided doses, but I was really impressed that they compared it to a blood pressure medication.
Does that come in a pill form?
It's a pill form, yeah. Yeah, and again, with anything, quality of supplements is important. I think that's one thing I'm glad that standardization is becoming a big deal. Up until maybe 3-4 years ago, companies just produced whatever they wanted. There was no FDA monitoring of these companies. So on the label, it looked like this, and it could have been, I don't know, sugar, for all we know. So now there's a tight control of the label has to reflect exactly what it's supposed to be. So I have more confidence in what's out there. But that said, I think you want to make sure that you pick a company that has a good reputation and it's been around a long time.
What is this tree turmeric?
What's that?
Tree turmeric.
Oh, it's just another type of plant that contains berberine. So there's a lot of plants. I have no idea what it looks like. It's not turmeric.
Yeah, my mind was going on turmeric.
Yeah, it's not. I mean, ironically, it has that look, but it's not. I think that one is from the Oregon grape, the powder that has come up. It's the yellow pigment from that particular berry. But there's different plants that have berberine in it. So a lot of companies, I think the one that I use commonly, it's from Oregon grape that they derive the berberine, but there's other types of plants that you can extract berberine. It's kind of like saying vitamin C, right? There's different foods that contain vitamin C. It's the same thing. So that said, I just want to summarize that. As much as I've kind of give you guys like a baseline of what things to look for, we always want to treat that individual person. So it has to be patient-centered and very kind of focused on the whole person and the disease. So that's really the whole point of naturopathic medicine. Prevention's always the most important thing, so education, prevention. And then again, treating the whole person and not just the symptoms. So hope I illustrated that with diabetes as an example. And then the newsletter that I usually send out kind of focuses on one topic every time, and it's usually around the next lecture that I give. So I think the next one is on arthritis. So again, it'll kind of cover, areas on prevention, what foods to look at, the pathophysiology of arthritis. I really try to address the whole person with everything. So that's the next talk. And then I'm just gonna.
You skipped right through.
What's that?
Are all the references on the sheet that you skipped right by?
Oh, I'm gonna go back. So I just wanted to skip that and then go back. This is all in your handout, but these are some books that I really like to give you more information on what we talked about today. My favorite is by Dr. Michael Murray. It's How to Prevent and Treat Diabetes with Natural Therapies. Dr. Bernstein is actually an endocrinologist. He has type 1 diabetes and he's not on medication. He's just, his book is so nutrition oriented, and if anybody is very kind of adamant about, I don't want to be on medication, if you follow his protocol, you'll be in good hands, and you could just use your labs to guide you to make sure that indeed you're on the right track. But this is a really good book. He's been highly regarded nationally, so this book should be in the library. Dr. Dean Ornish, who hopefully a lot of you have heard of, he's a very well-respected doctor, and he's got a lot of books about reversing heart disease. And then Dr. Sinatra, his newest book is The Great Cholesterol Myth, and he basically gives you a history of why cholesterol is not the only thing to look at when it comes to heart disease. So hopefully what we talked about today is a snapshot of what you want to read more of in detail. So I will leave this out, and then we'll just have a question. We have about 20 minutes for Q&A, so go ahead.
You said that the berberine is as effective as metformin, but does that also deplete the B12?
It doesn't, no. It's a really good question. It does not, no. Part of the depletion picture with metformin is, unfortunately medications come with side effects. So that's just one of the side effects of metformin. But no, I can't even imagine it depleting. It might even have some B12, to be honest, yeah.
Okay, and then I went to the Mendoza website.
Yeah.
Can you explain what the GI level, there's a plus and minus number right after that?
Oh, can you show me? I don't, or maybe show me afterward?
Yeah.
Unless, can you describe it? Maybe the group might want to know about it.
It says, like it'll have, like, for instance, cornflakes has a number of 81.
Okay.
And then there's a plus or minus 6.
Does it indicate portion sizes? It might tell you.
No, that's on the second. That was on the second slide that has the GI index, the serving size, and then the per serving.
Plus minus 6. Let me look at it. It might be a new thing. I've never seen that. It might be taking something into factor. I just don't know what that something could be. It might be like if you add milk to it, maybe it'll lower it, or I don't know. That's a really good point. What's that? It could be a margin of error, absolutely. Yeah, I've never seen it like that, so I'm really curious to see that. Yeah.
Thank you very much. That was very informative.
Oh, my pleasure. Thank you.
Please tell me your thoughts on Splenda.
Splenda is an artificial sweetener, so
So it's just as bad?
it's just as bad. Yeah. It's. I don't think it converts to formaldehyde like the way aspartame does, but I think there's still studies on it being a carcinogen. So, yeah, I'm not a fan. Yeah. Yes. Oh, okay. Sorry. Okay, go ahead, Carol. Yeah.
Bioidentical.
Bioidentical means something that acts identical to your body's physiology. So it's still synthetic. Anything synthetic means things that are made in the lab. It's not your body making it. But the action of it in your body is similar to what it would do in a natural way. So a bioidentical hormone acts more closely to what your body does naturally, the hormones in your body, whereas a synthetic hormone, it's kind of like a medication, what has potential risks and side effects.
And are any of these hormones that you went through, are they called hormones or not?
None of them are hormones. The only hormone we would talk about in terms of diabetes is insulin, which is a hormone.
Oh, it is?
Yeah. And some people need insulin. I'm not actually against insulin, but those who are put on insulin have to be super careful with, the effect of food and diet, because it's a potent hormone, right? So I didn't talk about it because a lot of people who are on it, they have like a diabetes educator, and it's like a whole other lecture. So I'd probably give that to those who are on insulin. It probably won't be something interesting to the group. But everything we talked about is to try to prevent us from going that route. Yeah. How about one here, and then Raj? Yeah, go ahead.
I saw you had some things that would mention for the protein factor, the cheese and all that, but I
Yeah.
thought that's kind of contra to it makes phlegm potentials.
Phlegm, like mucus. Well, dairy is a mucus-forming food. That is true, but we're kind of focusing more on the effects of protein. So there is protein in dairy. I could argue.
That was one of the part of the solution set.
Yeah, I mean,
Then it's contra.
it goes back to one man's diet is another man's poison, For some people, dairy is a good source of protein and a good source of calcium. For others, dairy can trigger hives and asthma. That goes back to individual differences, right? Patient-centered, right there.
Do you put your thoughts on vanilla chai tea? I don't know if that's supposed to be protein or not, but
Yeah, well, if you buy vanilla chai tea, it's probably got like 30 grams of sugar. Like, have you guys seen those in a package, like at Trader Joe's? It's like half sugar. So if you make it yourself with just maybe like black tea with some spices and don't put any sugar in it, by all means, go for it. But when you go to these websites like the Starbuckses or the coffee shops, they'll tell you how much sugar is in their drinks, and you'll be shocked. Like if you look at that 6 to 8 grams guideline that I gave you, you'll be like 30 grams, like not worth it, So it all goes back to what are you trying to achieve? What's your goal? So I'm not portraying dairy to be like a magic food. I'm just saying the presence of certain proteins help control blood sugar, and that was just one example. Yeah, sure, and then we'll go, yeah.
Is goat's milk better than cow's milk in yogurt?
For some people who are allergic to dairy, goat milk is better because it's a bigger protein, so it doesn't have an allergic potential. So some people have cow's milk allergy, but they can handle goat's milk. There are others who just can't handle dairy, period. So again, individual difference, yeah.
I have two short questions. One is these antioxidants you told that they help in the arteries,
Yeah,
antioxidants.
yeah.
I'm really curious what exactly they are doing in the arteries. Are they polishing something so the plaque doesn't come and dip? What exactly they are doing, and what was missing or what left out when a child is born? How the arteries do that child also needs some antioxidant, or with the age as we eat we really damage? So what exactly
Yeah.
is the science? And the second question is that very short. I'm always interested fruits and vegetables. Chromium is found in which fruit and vegetable? What do you will recommend?
Okay, so I'll answer the second one because it's easy. Chromium's rich in mainly brewer's yeast. So brewer's yeast or nutritional yeast, it's a type of, you can get at the health food store. It's hard to get unless you eat like leafy greens. It's very trace amounts of it is found. So it's hard to get it in amounts that I mentioned at like food-wise. So brewer's yeast is probably, I think there's like 50 micrograms, in like a serving of brewer's yeast, like a scoop. Whereas like the dosage we're talking here is like 100 to 500. So it's really hard to get through food. So hopefully that answers it. Your first question, I love. Okay, so hopefully the group can get a good answer from this too. Look up a certain word. It's called a foam cell, F-O-A-M. And it's kind of picture of foam. When you take cholesterol and you combine it with sugar and free radicals, it creates a nasty chemical combination. And it's the same way as you picture, like when you eat sugar, it causes cavities in your teeth. Can you imagine something as hard as your teeth getting cavities? How powerful are sugar and able to do that? So foam cell is this combination of free radicals and cholesterol and sugar combining together and creating plaques in your arteries the way it does in your teeth. Free radicals are basically unstable substances. So what creates a free radical is high temperature, things that break chemical molecules apart. So fast foods, fried foods, pollution, these are like chemical molecules that split the molecule, and when you eat it, they're crazy. That's why it's called free radicals. And they need to bind to something. Antioxidants, if you take them, they bind to the free radical and they protect your vessels. If you don't have antioxidants, then your vessels in a way are the victims. They kind of start to initiate that plaque formation. What blew my mind, and I think this is why I'm so proud of being an ND, is that we have the same textbook as MDs. And in my pathology class, I was blown away when I studied atherosclerosis that it's something that can start as early as age 2. These are in classic medical school books. It's not a naturopathic knowledge here, it's classic pathology. So it's something that, we're usually born whole, unless there's like a major genetic defect, but we have pure arteries. But if, a baby that young, as ages 2, if they're eating the wrong diet, it's gonna initiate heart disease. And that's why we're so on kids now about childhood obesity. And the good news about all of this, as depressing as it may sound, oh my God, 2 years old, we can atherosclerosis, is this stuff can be reversed. And that's why Dr. Dean Ornish has that reversing heart disease. So we just want to remove all of these and kind of give the body a chance to heal. So that was a really good question. Yeah. I saw your hand there, yeah.
I hate celery, but rhubarb a good substitute. The same
Oh, that's awesome.
Rhubarb.
I don't know if rhubarb and celery are in the same family. Pardon my ignorance. I don't know that. The research that I was quoting came from celery. Part of the celery benefit is it's a diuretic and it's also high in potassium. So that was the mechanism. I don't know if rhubarb has those, so maybe Google it and find out, but that's a really good question.
Is Perrier a good substitute for just plain
Perrier? Yes, in a sense that you're not getting that sugar. From the osteoporosis angle, they're preventing low calcium, like preserving bone mineral density. The presence of phosphoric acid, which is what carbonates, is basic Perrier is carbonated water, right? That can leach calcium from your bones. So once in a while, it's totally fine, but if you drink it every day, it could actually affect bone density. So it's kind of like, well, get used to the taste of water, but once in a while, go for it. It's fine, yeah. Yes?
So rhubarb and celery would not be in the same family.
Okay, thank you. They're not in the same family, now we know.
It makes me burp and I just hate celery or whatever. But if you make a smoothie and you throw the celery stalks in there, you don't taste the celery. So it sort of disappears. So I was going to say a smoothie is a good way to get the
Does
celery
it
down.
still make you burp in a smoothie?
That's one of the things, like I have a Blendtec, and it breaks down. I can't normally eat raw vegetables, but it breaks it down to such an extent that I can digest raw vegetables if it's done in a Vitamix or a Blendtec, whereas I couldn't otherwise.
Yep, I would agree with that. I don't taste celery in my smoothies.
On that note, you can make a nice juice. I have done, celery plus apple,
Yeah.
carrot. Oh my God, you will love it.
It's
You
true.
will get my glass even. It's so tasty, I'm telling you.
I agree.
You will take mine.
Celery and apples, there's a nice combination. Cucumbers too, just, yeah. Try that. Yeah.
I have two questions. You mentioned about aging and you mentioned about muscle mass, and I didn't quite understand what does it do? How does it enhance it? That was my first question. The second question is, how come you didn't have for your resources Dr. Oz? I email you and you refer me to him.
Oh, okay. Well, now I know who I'm talking to. Nice to see you. I remember my email. So I love Dr. Oz. Actually, one of the books called You Being Beautiful is a good anti-aging book. So that there's good references about muscle mass and aging. I love Dr. Oz. It's just the things that I quoted did not come from his book. It's not because I'm not, I didn't have any references about him. But a lot of the things he talks about quotes these books. So they're all gurus. They're all people to refer to. So hopefully that elevates Dr. Oz, the aging and the muscle. So a lot of the research we look at when we talk about, looking at aging beyond numbers, looks at, well, what is it that we consider aging beyond the, appearance, beyond the external aspect. We look at basically preservation of our tissues. And muscle mass is a really good indicator of overall kind of vitality. A lot of the, Dr. Oz actually talks about this a lot, looking at your physiological age, your biological age, and then your actually like age on paper. So the physiological or biological age is looking at various parameters like, your muscle mass, your cholesterol, your blood sugar, and a lot of those who are the most vital have the most muscle mass. A lot of times as we age, we lose muscle mass and we gain fat, and that almost reverses our kind of vitality. A lot of times, even when we look at osteoporosis, muscle preserves our bones. Muscle is really, we talk about the framework of our body. So there's a lot to be said about just your muscles being a good sign of vitality. So that's one aspect. There's another one that's a good anti-aging one. There's actually an anti-aging class that I give, and another one is called AGES. It's basically the combination of what sugar does to our cells. And sugar, it's the same as, when you fry sugar in high temperature, you see these like chemicals that come out of it. My terminology is falling here, but you basically don't want to fry sugar. Because it creates these free radical-like substances. And that's actually something that's been shown to damage our telomeres. Telomeres are basically like part of our DNA that's a measure of our aging. So if you picture your DNA like a shoestring, the telomeres are the end of the shoestring that hold the shoestring together. So if you take that end part away, the shoestring falls apart. Am I making sense? So the telomere is that end part that preserves the DNA. And there are now labs that measure the length of the telomere. And as we age, the length of the telomere shortens. So a lot of these things that I mentioned, people who are on like low-calorie diets, those who are reducing sugar intake, they have high muscle mass. These are things that have played a role in reducing the acceleration of telomeres. And you could even go the opposite ways and say, if I increase my muscle mass, if I lower the effect of sugar in my body, your telomeres can actually lengthen. So again, it doesn't have to go backwards, you can reverse it. And Dr. Oz talks a lot about that too in his shows. But you can measure that, that's what the exciting part is, and kind of make sure you're on the right track. So it's great information, yeah.
On this note, you were telling about sugar, my brain is started to work. When people make tea and coffee, especially Indians, I'm American citizen, but we generally boil and then we put sugar. So are you recommending Trader's Joe style, putting sugar on top, not putting mixing and boiling?
Oh, do you boil it after?
No, inside we put
everything. During.
And we put all milk and God knows all the spices, and we boil and sugar also. So if I put sugar because I'm boiling, I'm heating temperature, so it is better to put,
So the reason I'm not sure about that is the product that I'm talking about that is from frying sugar is it's exposed to oxygen. So it's basically on a frying pan with oxygen exposed. I don't know whether the presence of water preserves the oxidation.
Thing also. When we make some sweets, we really fry the sugar.
So that's probably a bigger danger than just maybe in the liquid form.
Coconut oil to anti-aging, here is the
Good
program.
evening. The library will be closed in 30 minutes. If you need
We
any
were still
library
okay,
cards,
yeah.
please
Then
go to the welcome
caramelizing
desk
onions
now.
would be
Thank you.
bringing the sugar out of the onions. And they always say caramelize them where you're going to fry them.
It could probably, I don't know if that's the same as the caramelizing sugar, but I would say it could affect the way the nutritional content is. It's kind of like raw nuts versus roasted nuts. They're not as effective. So, you compromise taste, but you don't get
Raw nuts are better.
What's that? Raw nuts are better than roasted in terms of the nutritional benefits. Yeah. Yeah, that's true, but they're better for you. Yeah.
Where do you recommend buying some of these minerals, vitamins, oils?
It depends on which one. So there are some where, I'll give you some brands to look for. Again, it really varies. So I think in terms of fish oil, I like Nordic Naturals or Carlson. Those are two good brands. Barleans is also a really good company. The other company I like is Now Foods, NOW. I think it's like an orangish jar, something like that, for minerals like magnesium, chromium, that sort of thing. With herbs, I like Gaia, Gaia, or Herb Farm. So those are some general guidelines, and then again, it just depends on the product. So yeah, yeah. Berberine, I've been using a doctor's only product for that. It's a doctor's line, like a Thorne Research is what I use for it. So it's not available over the counter because I want to use it as medicine, not necessarily as just, take it like water, So there's certain things that I'm kind of more about, well, this is a treatment plan for a specific patient, not just everybody needs, a B complex or fish oil. Those are more general, so I can easily say, well, go again, Nordic Naturals, everybody can benefit from it, but it's more specific for that person. So, yeah. Mm-hmm.
You talked about sweeteners, and you said something about honey. I didn't catch that.
Honey in limited amounts, so maybe like no more than like a tablespoon or maybe a teaspoon a day. It just, it's still a little bit better than, agave is pure fructose, whereas agave has some glucose. Fructose is just really hard on your liver and your insulin, whereas glucose isn't as bad. So honey is just kind of, we're on the fence, just limit it as much as you can. Yeah, you're welcome.
Where does pure maple syrup fall in that?
It's again both glucose and fructose. I don't remember the ratio, but it's again limited quantities. Yeah, I saw your hand. Yeah. Yeah.
You mentioned about good fats, and you mentioned that there was some good fat for your cells. What are good fats? I scribble fish oil.
Fish, flax, walnuts, avocados. Help me out, group. Olive oil. Coconut oil. Sesame oil. Yeah. Fish. Thank you.
I have a question. We have good cholesterol and bad cholesterol, like good fat and bad fat. Do we have good sugar and bad sugar? Or sugar is sugar?
Sugar is, I love it.
There has to be something.
Okay, so sugar is just like a general term that we talk about, but what is sugar? Sugar at like the basic molecular level is glucose, okay? And then two glucose molecules make fructose. And then from that, we talk about complex carbs, which are like multiple chains of glucose. So the very base of sugar is glucose, but then different components make different ones. There's also lactose, which is the sugar made from dairy. So they're different ones, but the very essence of sugar is glucose. Again, it's about the load, right? Too much sugar, you see what it can do. But we need sugar. Our brain needs sugar to live. Why do we pass out when our blood sugar is low? Because you get down and then the blood goes to your brain. So we need sugar. We're not, we can't go without it. It's just how much of it do we need to survive versus get disease. Yeah. Mm-hmm. That's true, and you'll see a lot. Thank you for that. There are a couple new things on the market you'll see. There's coconut sugar that's been out in the market, and also xylitol That's another one that's low in glycemic index. So they're basically the effect of it on the insulin isn't the way sugar. Remember that graph we had where it spikes it up and crashes it? It doesn't do it. The glycemic index isn't as high. It's still a high glycemic, but it just doesn't do it the way pure sugar does. So either coconut sugar or xylitol is a better alternative if you're using it in cooking. But the reason I didn't mention it as much as I did with stevia is stevia has no effect on your insulin or blood sugar. So if you can get used to using that, that's even a better alternative, especially if you're diabetic. So yeah.
On your site, if you were to go to your site, do you have notes for this lecture?
If there are particular slides you've missed, just email me or tell me what you're looking for. I can like make it in a note format. It's just hard to send it. And some of them are copyrighted, so I'm a little bit respectful of those who shared it with me. But just let me know what you need. I'm happy to share it with you. Yeah.
What coconut water, is that good?
It is, yeah. Coconut water is basically just taking the electrolytes from the actual coconut. So yeah, that's fine. Yeah, it's a great way to rehydrate. Some people use it as a natural electrolyte support.
So I might start drinking that, so I was wondering.
Yeah, especially if you sweat a lot.